Hi everyone, thanks for joining us today in the Firkin and Crane, and to everyone who's joining us online, thanks for tuning in. My name is Eleanor, and on behalf of the Sexual Health Centre, I'd just like to welcome you today on World AIDS Day to this panel discussion, End HIV Stigma, a Cork Reflection. Before we begin, I would just like to thank a few people. So first of all, I'd like to thank HSE Arts Health for funding this project, and specifically to Eleanor Moore and Trina Healy from the HSE Cork South Community Work Department. I'd also like to thank the people living with HIV who have participated in this project in the months leading up to today. So just to sort of give some context about the End HIV Stigma project, it's not just today's talk. We started off with a workshop a few months ago with people living with HIV, where we sort of discussed HIV stigma and the way that it sort of affects their day-to-day lives. And we came up with sort of creative responses to this discussion of stigma. Then following that, we did the End HIV Stigma zine, which was sort of collecting these creative responses, collecting information about HIV treatment and care in Cork, and sort of a little bit of myth busting about sort of myths about HIV. And then following the End HIV Stigma zine, we're delighted to have launched a mural in Cork City on Grattan Street, which is a sort of a fantastic part of the public conversation surrounding End HIV Stigma. And then today we are talking about End HIV Stigma, and we're going to have a brilliant discussion with our panelists. So just to give a little bit of context about HIV stigma, a lot of the stigma that still exists today is partly residue from the very sort of sensationalized misinformation that was circulating when people first began acquiring HIV, decades ago. We're lucky today that HIV treatment has advanced significantly, so that a person living with HIV today can expect to live a long and healthy life. We still find, however, that people are hesitant to get tested and treated, and it's partly down to this stigma attached to HIV. So something that we really want to spread today on World AIDS Day, and also just in general, is the global U=U campaign. So U=U, which stands for undetectable equals untransmittable, means that a person who is HIV positive but is on effective antiretroviral treatment to the point where their HIV is undetectable, they cannot sexually transmit HIV, which is like a really fantastic progress in HIV treatment. And so the global U=U campaign is something we'd love for you to take away today, after today, and talk about it with people, not just today on World AIDS Day, but going forward as well. So yeah, that's just a bit of a context about the project and why we're here today. I think I'll just jump straight in and introduce our speakers. So here we have Siobhano Dowd, who is a community worker. She's a project coordinator for Ballyvahan Toker Community Development Project, but she's also one of the founding members of Cork AIDS Alliance. So that was also the Sexual Health Centre back when it was founded in 1987. We're also joined by John Sheridan, who's here representing ACT UP Cork. ACT UP Cork is an activist group that stands up for people living with HIV. Here we also have Will Kennedy, who's representing Positive Cork, which is a peer support group for people living with HIV in Cork. And then we have Jonathan Lynn, also known as Canvaz, who is our street artist behind the wonderful End HIV Stigma mural that we have going up. So guys, thanks very much for joining me today in the Firkin and Crane. I think I'm just going to jump straight in, and maybe Siobhan, you can give us a bit of context about Cork AIDS Alliance and what the climate was like for people living with HIV when the Cork AIDS Alliance was founded in 1987. What was it like back then?
It seems like for I came across this quote the other day. We are dealing with a disease that knows no barriers or boundaries. We know that this infectious disease will not be contained in any one continent or any one country. We need international cooperation and financial resources dedicated to medical research and to finding a cure. And then this is not a moral issue, but a health issue. And like that could apply currently to COVID, but it was that was 1988, a Shannon debate, and that was Senator Nuala Fennell answering the Minister for Health, and I think what was very welcome about what she said, and even some of what the Minister said, was that it was a health issue, not a moral issue, but it wasn't always seen like that. And so suppose Cork is a second city. So there's a perception of HIV and AIDS as being out there somewhere. Cities, other countries, other continents. And, you know, if you stayed away from those, you were fine. Also, you know, maybe a sense, and it's worth looking back at that debate, because a sense that almost, you know, Ireland as an island would be exempt because of its Catholicism and because of its island status, and you know, just that unwillingness to deal with stuff, to name stuff, and then there was all the kind of misinformation, you know, so the confusion often between HIV positive status and AIDS. And, you know, there's one of the earliest kind of state-produced booklets was it's a health education board. It calls the test the AIDS virus test. It wasn't, and like, this is our Department of Health. So I suppose the gay community here in Cork would have contacts and experience of people who were HIV positive, but also from, you know, kind of friends and family and, you know, gay communities living abroad. Because like Ireland in the 1980s was high emigration, and some of that was economic, but an awful lot of it was social. It was about people wanting to be able to live the life they wanted to lead, at least a little bit more openly. And my own connection was, I was a postgraduate student in UCC, and to earn a bit of money, I was tutoring on a community women's education access initiative. And one of the women, her brother was HIV positive, hemophiliac, young, married, straight, had a family, and he had been given contaminated factor VIII, which helps to clot blood for hemophiliacs. And he wanted to create a support group. And I think, you know, really amazingly for his time and his background, he wanted that group to be open to everyone. You know, so he didn't want it to be for hemophiliacs. He wanted it to be for everyone who's impacted. So I'm echoing. So I suppose, unlike maybe some other cities, it was a very mixed group who came together. So you had that core working class family. You had lesbians and gay men who had worked on the different helplines. You had a kind of a range of age groups, a range of sexualities and sexual orientations. So it was a kind of a very mixed bag. And also I think Cork's a small city, so you had, you know, people who'd campaigned on against the amendment around abortion and also divorce, because like that's the kind of social context, really strong kind of confessional ethic, and then, you know, kind of groups like ours trying to do education, to provide information, to run helplines, and then to give support to people who were affected and their families. So
great. And what kind of support did Cork AIDS Alliance offer to people who were affected and their families?
There was a group called Corja, and Corja is the Irish for friend or friendship. So that was about practical help and support. So it could be financial support, help with securing rent, accommodation, hospital transport, lots of stuff happened in Dublin, so maybe travel costs. The helpline was, you know, kind of the basic, from, you know, kind of people who were worried to people who thought, you know, simply being gay or being in the presence of someone who was gay you might contract HIV that way. did information sessions for schools, for colleges, and you know, again, kind of in the early days, supports for people who were ill, and up to end of life care, because the hospice at the time wouldn't accommodate people with AIDS. So I remember kind of end of life care being provided on a rota basis by volunteers, and some brilliant public health nurses, has to be said as well, and the medical team in Victoria, the STD clinic, were they were so brilliant in comparison to, because, you know, medical professionals or social work professionals, doctors, they're not apart from this society, so they're just as affected by the prejudice. You know, they don't get any immunity from that just because of their training. So, you know, Chris Sheehan, Tony Woodman, Jack Cantillon, like, they came out on talks with us, and it was really good to have that kind of backup as well. So those were like everything from, you know, helping with shopping, like we're doing at the moment with COVID, to end of life stuff, which, you know, now is actually done by people who do it brilliantly.
Yeah, that's brilliant. And you sort of touched on it a bit there, but I guess the stigma that people living with HIV at the time faced, you know, was in the community, but it was also in, you know, medical settings, and it was also in public. Like, what was the kind of public conversation around HIV and around Cork AIDS Alliance like at the time? You kind of touched on this a bit already.
You know, maybe a bit of fear, or what are you getting involved in that for, or and also loads and loads of misinformation. I mean, I suppose journalism in Ireland wasn't as bad as some places, but you know, I remember someone who died in Portlaoise, Mountjoy, and there was a newspaper article that named that man, named that he died of AIDS, and that his brother was also had AIDS and was in the same prison. It was a very sensational kind of Sunday one. Might have been the Sunday World, which is like, you know, selling AIDS. It was a prostitute who was HIV positive. And there was a real quick slide from, you know, HIV positive to AIDS. Language, I mean, we like in outreach, there was loads of stuff done about language, from that distinction between positive status to AIDS. You know, on the one hand, maybe the kind of charitable AIDS victim, as if people who had AIDS had no agency, to AIDS sufferer, to AIDS carrier, you know, the gay disease, gay plague, that department booklet, I know when it talks about the groups who are likely or are being impacted in Ireland, talks about drug abuser rather than drug users. So, and that was a big group affected as well, particularly in Dublin. It was IV heroin users who were injecting, and that was true of Scotland as well. I think Dublin and Scotland kind of, or Glasgow especially, stood out because maybe in other places heroin was being ingested, but not, it wasn't through needles, and there wouldn't have been needle sharing. So, like, all of those things, and then there were I suppose it's one of the reasons I had such respect for Ger. There was you know, there's kind of innocent victims, hemophiliacs, babies born to parents who were positive, and then presumably, if you say innocent victims, well, then you have culpable victims, and that was a judgment on people's sexuality and their orientation, or on addiction, or, you know, so yeah, it was a time. Yeah.
Yeah, absolutely. Yeah. And I guess it really does highlight the sort of need for activism at that time, and just how you kind of get people talking about it in the sort of right ways as opposed to spreading misinformation. And so I thought, John, maybe you could tell us about ACT UP, how that was founded and how, as an activist group, it was kind of responding to the sort of stigma that people living with HIV were facing at that time.
All right, thank you. Yeah, it's exactly the same time that Siobhan's talking about, where she's beginning to just help the people that are being diagnosed here. At that time, in 1987 in New York City, they started ACT UP, and ACT UP is the AIDS Coalition to Unleash Power. And the whole idea was that when HIV had first come out in the very early 80s, it was a death sentence. It was still much of a death sentence in the late 80s. However, there was already beginning to be some medical treatments, some possibilities of medical treatments. And yet, the one thing that wasn't changing was the stigma, as Siobhan was talking about, from the original statements about who's the innocent victim. Well, of course, if you're an innocent victim because you got it through a blood transfusion, that means anyone who didn't get it through a blood transfusion was a culpable victim. So ACT UP, we formed it because we had no choice. The thing is, at the time, we were literally fighting for our lives because most of society had decided that anyone who had HIV could be simply written off. It was, people that deserved death. You either deserved it because you were culpable or because God put you in that group where, you were an innocent victim, but just like polio, just like cancer, well, that's what God gave, that's God's plan for you. So it was the idea of anyone who had it was basically deserving of death, and therefore there wasn't really any effort being made towards addressing the issue. It's very different for me today to look at the way that society has reacted to COVID, and we're all in this together, and hey, let's try to find a treatment, giant effort to find a vaccine, all of this. When we started seeing our friends die in the 1980s and literally ran out into the street and said, if you don't do something, everyone's going to die. And society looked at us and said, okay, did nothing, and then we watched everyone die. And so screaming in anger, in frustration, in terror for losing your life, that's how ACT UP came about, where we literally started as a coalition of people who were just so damn angry about being pushed aside that it was like, we're going to do something. So they organized such things as die-ins, where we literally, okay, you think it's okay for us all die? Fine. Everyone laid down in the middle of Wall Street and had them draw chalk outlines around themselves. This is the die-in. We also wanted not only to call awareness to the fact that what was happening, but also trying to improve the situation where things that are now common, such as early access to drugs that are in studies, that didn't happen at the time. And when we knew that there were studies happening about drugs that could help, we became the activists that literally went and shut down the National Institute of Health in Washington, D.C., went and picketed at Anthony Fauci's office because we wanted all of medical society to change, to allow us as patients, as the people that were infected with the disease, to have a say in how it was being addressed. And I must say, all of those in-your-face actions got results. we wouldn't have gotten to the point where we are today if we hadn't done the things at the time. We were fighting for our lives, medically as well as societally, because medically we needed to address the changes that needed to be made in the medical community so that we could get what's now considered patient activism or patient empowerment, as well as getting access to new pharmaceuticals, getting drugs developed that were considered to be appropriate for us, as opposed to just everyone saying, oh, don't do anything for those people, they deserve what they've got. And the societal discrimination that happened, which completely shut off these people that were infected from the rest of society. I mean, to the point where several politicians in multiple countries proposed concentration camps for people with HIV, and just trying to shunt away the problem. But of course, it wasn't something that was able to be hidden because, you know, we were a large segment and growing segment of society.
And it was about sort of creating visibility
Yes.
for yourselves. Yeah.
Yes, and that was the birth, the ACT UP came out of that fight against the stigma, knowing that it was the stigma that would be perpetuated. And to this day now, we're now in a situation where medically it has changed 180 degrees. We're no longer a sentence of death. However, the issue of stigma has changed very little in the past 40 years.
And so you were just discussing ACT UP New York and the sort of ACT UP activism in America. How did that come to Cork and how did that come to Ireland?
Well, as Siobhano was saying, it's just that there have been people here working to help the HIV community all along. However, there has always been the same problem here that she was addressing then, the stigma. And to this day, the greatest problem for HIV being spread in Cork, in Ireland, is because of ignorance and because of the stigma about learning about it. There's, so yeah, I think that's the need for ACT UP has never ceased to be, which is why it's still here today.
And how long has ACT UP been in Cork?
I'd say formally since Will Kennedy went to the Pride Committee and said, why don't we have some HIV mention in the parade? And they said, well, no, we don't want to have that as our image, because at that time they were working for the marriage referendum. So this would have been 2012? 16 that, and so as really a response to that, we formed ACT UP just simply so that we could have a presence in the Pride Parade, because the idea that the gay community of Cork didn't want to have anything that said HIV in the Pride Parade because it was something to be hidden. Well, it's not something to be hidden, it's something that we need to address within the community. And so that's really where ACT UP came from in Cork.
And that's obviously quite recent, you know, and there is still a need for activism in Cork today, you know, would you say?
Oh, yes. Everything from if one looks at even the way that we've been able to publicize this discussion on HIV stigma, I think that there is honestly a low turnout here and a low ability to promote these discussions, because there is a stigma about having a discussion about HIV stigma. And that's the point at which we are really gotten to right now, as opposed to what we really need to focus on is normalizing the idea of HIV status. Not everyone should be normalized to having HIV, but that everyone should be tested. That it should be normal for everyone to know whether or not they have had a test and whether or not they're positive or not. Because we know that if we get everyone who is positive, if we get them under treatment, we literally can stop the entire spread of HIV. The spread of HIV, we have known how to stop it for 30 years, and we haven't done it. So it's the reason ACT UP and others are still here and are out pushing today is because no one has done what they were supposed to have done 20 years ago.
And so, you know, I think just from what you were saying there, it sort of does show the importance of, like, say, people living with HIV standing up for themselves and, you know, supporting each other and, you know, having sort of allies in the community, of course. But I just wanted to talk a little bit about the sort of peer support opportunities in Cork. And well, I suppose I was wondering, could you tell me, you know, what is the significance of peer support for people living with HIV, and what are the opportunities for peer support in Cork?
Before I get on to that, it's just pretty hard to follow the last two people. Siobhano was really right about it being a global epidemic, because the theme for World AIDS Day this year is End Inequality, End AIDS. Yes, we are really, really lucky where we live as regards treatment and everything. I get free access to my medication, and my medication is the thing why I'm sitting here today alive. But around the world, people who can't access it because of lack of funds, lack of money, seen as the stigmatized people, sex workers, trans people. It's appalling still, like the state of HIV today around the world. But that was just something I wanted to say about the theme of World AIDS Day today. As regards peer support in Cork today, just leaning on from what John said, actually, I was involved with ACT UP Dublin long before ACT UP Cork, but I really felt that there was nothing happening much in Cork, and was shocked when I actually went to the Pride Committee that time and was told it's not the right time. Basically, like, it made me feel as a HIV positive, a man living with HIV, I was not the face of that wanted to be seen. Like, you know, I don't know whether people realised how much it hurt at the time to be told that. And so I just felt like we needed something. I had been a member of POSNO in Dublin since I was diagnosed in 2007, so I think I became a member of POSNO in Dublin in 2009. Because it's strange, I really knew nothing in Cork. I was going to the clinic 2 years, and I had never heard of Peter Street. I had never heard of any support. Nobody mentions it in the clinic. And so we went up to Dublin. We had heard that there was this meeting going on in Dublin about trying to start a positive group by positive people. And at that meeting, there was 3 of us sitting there from Cork, and everybody was going on, and we were like sitting there, well, you know, there's nothing in Cork. And this woman, Deirdre, people would know her at the time, pipes up from a corner, but where in Cork? Where? And I was like, hold on a minute, I have to travel all the way to Dublin to find out about a service in Cork that's actually going. I said, why didn't I hear about this? You have counselling, free counselling and everything. So I went back enraged to the clinic, and that's when I started all this, like, about peer support, because we're the experts on living with HIV. I know the medical profession are the experts on treatment and everything, like in the meds, but we are the experts on living with HIV. So when you're newly diagnosed, I feel peer support is really important. And leading on in my activism, about 4 years, maybe 5 years ago, I actually went to I was at a meeting, and at that meeting, the idea of peer support was spoken about. So I came back to Cork, and I emailed Gosh and Limerick, I emailed Dublin, HIV Ireland, I emailed out West of Call at the time. Maybe we should look into starting peer support, proper peer support, rather than like somebody at a clinic talking to somebody casually. And again, this is going to sound weird, we couldn't get anything in the south of Ireland. A charity in Belfast, Positively Life. Every group is called Positive Life and Positively, so I might get a bit mixed up. And we were up in, they actually invited 15 of us from the south of Ireland up to Belfast, and we did training, peer mentor training, paid for everything. And then after that, I went to London to do training the trainer. Came back to Cork, all excited, really thrilled. I had all my training and everything. Presented it to our local NGO. I'm not running anybody down or anything, and basically nothing has come out of it. Whereas HIV Ireland last year, in concert with Positive Life in Belfast, is that Positively Life? It's Positive Life in London. I honestly get mixed up. They have initiated the proper peer mentoring program. See, it's one thing when when you have a support group like we have, Positive Cork. At that support group, we do not sit around talking about like dying or illness or blah-de-blah. We talk about our lives, how we get on, even people now today, housing. We have a member recently who had a baby, and it was brilliant because now, like with the undetectable, the fact that she could have that baby, have sex naturally, have a baby naturally, the mother-to-baby transmission, but yet her concerns, even though she knew all this, her concerns going through her pregnancy, it was great to have a group of people that could talk to each other. That's that side of it in the group. We do support each other very well through things going on, but peer mentoring, done the way we did it in our training, and I would love to see it implemented here in Cork. I don't know why we're left out of the loop. If the clinic, the way it works like in England where we did my training and in Belfast, the clinic, the local NGO and Positive Cork get together, newly diagnosed, we say access a building, an office or something either in the clinic or in the Peter Street Centre. The person who's trained as the peer mentor is in there at a certain time. Somebody who's newly diagnosed is sent to them, because when you're newly diagnosed, you may not want to talk to a counsellor, even though there's free counselling. You may not want to go to a support group. You just are so in shock and so full of crap. It's great to talk to somebody who literally has been there. I think peer mentoring, everybody would know, in every situation in life is now proven to be absolutely the thing. Like, so when you come, what I would like to see is like that the newly diagnosed is sent, because you walk in and you can literally from the first day arrange proper boundaries and settings. You can tell this person, this is, the way the training is done, like, and the way we run it out, is that there would be 6 to 12 meetings. If you need more, definitely more, because it's to get a person grounded. You have all the services, we have it all there, we have the info that they may need. But sometimes a person who's newly diagnosed just wants to sit there and cry and say, what am I going to do? Because unfortunately, like you said at the beginning, much of our information around HIV today out there in the general public is still tainted with what happened in the 80s. The language, everything is still around it. I mean, listening to Siobhano saying the innocent victim and the culpable victim, I've been asked by medical professionals, how did I get it? Why? What has that got to do with it? Like, it makes me feel when I'm sitting there, are you making a judgment? If I respond, if I responded, I got it from a blood transfusion. Oh, would I be the innocent? Would you treat me different? And it just really aggravates me that there are over 7,000 people in Ireland living with HIV today. And every year when it comes around to World AIDS Day or anything, there's a few familiar faces dragged out. I was watching Robbie Lawler and another friend from ACT UP Dublin on TV3 this morning. And if there's 7,000 or more living with HIV in Ireland, where are they? We are invisible. We really are invisible. And the horrible thing about the invisibility, I sometimes think, Robbie said to me once, is the personal stories that really impact. I know of people living with their families and they've never ever opened their mouth about their HIV status. They go to the clinic, they get their medication. Why? They're literally terrified. And we do know that they cannot infect anybody, that nothing, I'm untransmittable. And so I meet people, 20 years diagnosed, and they've never spoken to anybody. Now, the example I give you, where really horrible to be living with a secret. When I was diagnosed with cancer in 2011, and I compare my treatment when I was diagnosed with HIV. HIV. You don't have to tell anybody. You don't have to be the poster boy. You can keep this to yourself. It's very important for work or for this and everything. I wasn't going to run out and tell my job and the whole world. But please, is there someone I could talk to? Nobody mentioned Peter Street. 2 years running around looking for it. Diagnosed with cancer. Social worker walked into my room the first day up in CUH. medical card within 2 days, support, everything going on. There's our house for cancer. And it's like, who will we tell? Who will we ring at home for everything? And I was like, there's something. So I was just lying in that bed thinking, there's something wrong here. Why was that like such a secret? I get it. I'm not advocating for people, in case some people, it's been put to me sometimes, not everybody is like you will. But I grew up, because I was born in 1957, I grew up in the 80s when it was illegal to be gay, when there was everything. So if you put HIV on top of that, there was 2 secrets you were living with. How could you actually even go to a medical professional or seek out medical help when you knew you were going to be judged, 1, on your HIV status, but also you're a criminal because you're a gay man? Like it was horrible. And I just feel today that people who live with a secret really need to be relieved of that secret. That's why I love peer support. That's why I do what I do. I'm passionate that people can reach a stage where they can feel like me. I almost go to course. But you can just say to people, I don't care what you think of me. I've heard people say, like, I want acceptance. That's all. I really just accept us as we are. I spent my life as a queer man, I identify as queer, growing up, craving outside acceptance from anybody. And I did horrible things to get acceptance. And I believed what I was getting was acceptance. Today, I don't want anybody's acceptance. I want to be treated with respect as an equal. I'll treat you I'll accept you. That's the only kind of acceptance I want and will accept. I'm not seeking, and I want that for everybody. Now, I don't see everybody running out there, and I don't advocate for it with HIV, blah, 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 to the world or sitting out like this, but I want it to be normalised for them when they're diagnosed. They're given the support, they're given the information, they're told you can talk to family members. Let's normalise it. Let's make it something like, if you look at TV, and I only know this through my cancer, is when I took notice of it. There's ads all the time for breast cancer support, for this cancer support, men's prostate support. There's all the time, like it's constant. When do you hear HIV? Once a year, and again in June on Irish AIDS Day. Why can't we have this consistent outpouring of information, of things, and change public perception? Recent surveys done in Ireland, it's amazing, in the public. 11% of people still think you can get it from kissing. 23% of people think you can get it from toilet seats. It's like, I bang my head off a stone wall like I feel like I'm doing when I hear this, like, because I think, what's going on? I know Robbie won't mind me saying this in Dublin. When he was diagnosed with HIV, he didn't know what it was. Robbie literally had no information, and I met 4 people last year, again, not through the clinic or Peter Street, no criticism of anybody, but it was word of mouth that they heard about us. I went to meet 4 guys who were diagnosed. 2 of them, 2 17-year-olds, knew nothing. What a reflection is that on our society? Forget about HIV. They knew nothing about sex, safe sex, anything like that. They just went off out there. And unfortunately, HIV positive. So John speaks about anger. I'm still very angry. I am very, very angry at the treatment. It's an illness. Today, and words, like Siobhano was saying, today I don't ever say I'm HIV positive, I'm living with HIV. Because for me, when you say you're HIV positive, it mightn't sound to other people, but I never said, I am cancer. I have cancer. So I'm living with HIV, and for me, people need, I honestly think, to be open, to be honest, and medical profession in particular, oh God. It's surprising, Siobhano, when you said like the way they treated us back in those days, but dentists are still a big problem today. They're still a huge problem. They're not as bad as they were. Medical professions asking you inappropriate questions. The training that needs to be done around HIV, and I'm sorry to say this, I believe we're in this position in Ireland because of the shame we have around sex. If this illness was not connected to sex, I think it'd be totally different. And maybe that's a long-winded way of saying why I think peer support is important. We are the people who can help each other. Newly diagnosed person coming to me, like that woman who had the baby, she can talk to somebody who can really reassure her, who can tell her exactly, no problem, there's no danger of you transmitting to your baby. Somebody who comes to me about a problem in work, if they've been mistreated or anything because of their HIV, we can get the support for them. I mean, there was a case taken in Dublin a couple of years ago, a guy in Positive Now, and he took a case against a chiropodist. It was a fairly case that was out there in the newspapers, a chiropodist refusing a treatment. But as peers, we're the ones who know that. I think it's one of the most vital things, and I wish that it would get much more support in Cork. And I have, because I'm always optimistic. I get beaten down, but I keep going. I have high hopes for, people may not have heard about it out there, the Fast Track City initiatives, which was started in 2014. We only joined it 2019, I think. But there's going to be proper funding now, proper resource. We will be answerable for the things we're doing. And I'm really hoping that we can access funding to have proper peer mentoring rather than just casual, which I love still, meeting friends in cafes, chatting, reassuring people, but proper peer mentoring. It's vital.
Yeah. And it sounds like, people living with HIV, not even just people who are newly diagnosed, but at any stage in their sort of HIV journey still need that sort of support network, because, you were saying, say, for example, the woman who has just, had a baby, she still needs to be reminded about U equals U and everything. I also just wanted to touch on U equals U. I just wanted to ask, because U equals U is quite a recent campaign from 2016, what does that mean? What is the significance of U equals U to you?
Life-changing, utterly life-changing. I'm untransmittable, so I don't care what anybody says about me now, because I cannot pass on my HIV, so it's that, what you... Actually, when I say that, it does hurt sometimes. I'm a queer man, and in the community, when you... 2007, I was never going to have sex again, never date again, never do anything again. All that was gone, because I was diagnosed. And it was ridiculous because I knew everything about HIV. But to give an example of how it can affect you when you're newly diagnosed, I worked with the Gay Men's Health Project at the time, so I knew everything about it. And when I was diagnosed, November 2007, on a Monday, I'll always remember it, I rang a lesbian friend of mine at the time, and she said, come over and we'll chat. And I will always remember what she did for me that night. We were sitting across from each other, drinking coffee. And I was like, what am I going to do? I'm going to have to get cups, get towels, everything at home. And she just got her coffee, switched it around with mine, and called me an effing idiot. It just groaned at me, it really was what I needed. It was oh my God. And I've kind of gone a bit off track. But U equals U changes all that. Because now, if you're diagnosed and you no longer are. I hate using the word infectious, so it's better untransmittable. And it's a vital message. There's so many ways now that we can prevent HIV, not only in the treatment, there's PEP, there's PrEP, but U equals U as a message for ending. It's called treatment as prevention. If it's done properly, if everybody, say, who is sexually active gets tested, gets diagnosed, gets on treatment, and then on lifelong care after that, for the treatment, your viral loads are suppressed. This is how we end it, because you can no longer pass it on then, because all those people... The problem with the rise of HIV in Ireland, again, I bring it back to fear of stigma, people are not getting tested, shame around sex, is that you're out there, you're having sex, I meet somebody, and I'm going to talk about personal, I will tell them straight out my status. They now have fully consented to have sex with me, say, with all the knowledge that I am, but I can't pass it on. But I meet somebody who is not being tested, who doesn't know their diagnosis, and that's how HIV is still spreading. And yet we're the ones who are stigmatized because we get tested and we get on treatment. We then end up as the ones who are, oh my God, look at them. I've had some horrible things said to me by other queer men. I actually was accused of making up U equals U one night. Sitting out at dinner on a second day, thinking all's going fine. I'll tell him that I'm positive. Because this might be going somewhere. And he just turned around and looked at me and said, sure, somebody like you would make that up, wouldn't they? Basically, because you want to get in my pants. I'm resilient, thank God. And I just stood up, threw my money down my handy bit, and I just said, listen, if you really think somebody like me would want to get into your pants, you need to look at yourself, man. I said, this says more about you than it does about me, your lack of knowledge, your ignorance. And I think that's the basic problem. I can't blame, to a certain extent, the public, because there is no information out there. There really is. I look at it, I was stunned with the recent Roman Catholic, shall we call it, sex education and relationship thing, where it spoke about like marriage between Mammy and Daddy, and it's only for sex, is only in marriage. I thought, really? It's 2021 in Ireland. And this is what I feel is wrong, is utterly wrong. We have this shame we still carry over about sex. And the ones who suffer because that shame then are the ones who are, sorry, the visible side of it. We're out there. But because of you equals you, I feel it's such a life-changing message. People, a heterosexual couple, can have natural sex again, can have children normally, no fear of it. I can decide what kind of sex I want myself because of, I know I'm untransmittable. It's utterly changed everything. Like it's made me feel like it's back before I was positive. I can now do what I want again. So I would say for anybody who's newly diagnosed in the clinics, it's the first thing they should be told. And I don't know if it's happening. And my experience from talking to people anecdotally is it's not happening. Because the medical profession, some of them have this fear. It's been an argument put forward in the medical profession. Somehow, if you tell them you're undetectable, it might lead to having sex or whatever. There's this weird idea. It's like if you speak about condoms, they'll have sex. It's that still weird idea. But I think it's the message that should be given to somebody straight away when you're diagnosed. Yes, you have a lifelong condition. Yes, you're going to have to take your medication, but you are undetectable.
Yeah, that's brilliant.
So, yeah, it's a brilliant message.
And it's something definitely that we really try to get out to the general public as well, because you never know who will be newly diagnosed. And so taking this kind of discussion about stigma and HIV stigma in particular, and turning that into a public facing mural, I imagine, Jonathan, was a challenge. So I guess, could you tell us about how you translated this discussion into the mural that we have on Grattan Street?
Okay. Well, first of all, in a weird way, when I was kind of coming of age, my younger brother was running around UCD with a shopping trolley and a condom machine because they were illegal. And I thought this was just fucking brilliant. like it was like, people forget that in the early 90s, it wasn't just AIDS was a bad idea, sex was a bad idea, safe sex was a bad idea. And also around that time, so ACT UP, when you were saying it, I was like, there was people in New York like Keith Haring, who was a huge hero, the Dice Man in Dublin, and it wasn't just AIDS or nuclear war. He was doing Barry's tea. You know what I mean? You'd see this kind of, I don't know how to explain to a normal person without showing a photo, how this man was advertising Barry's tea and on the Late Late Show. And the Late Late Show would go on for hours back then. People don't really realize it would go on until whenever we're bloody ready. And where I went to school in Dublin, he lived on Gardiner Street. And because he was on Late Late, he'd kind of do the wink. He knew you knew. He'd give you the wink. And so if you're into graffiti, which street art wasn't really a thing, Keith Haring, Basquiat, Keith Haring was doing the Stop AIDS posters. And then Benetton was doing, I think it's almost the face of Christ I think it's the last grasp of an AIDS victim. These were billboards. They were in Dublin. And I was going, yeah, that's the kind of stuff I want to do. You were like, this is cool. Doing the new ad for, because they don't, if you tell your parents you want to become an artist or a painter, someone at some stage is going to go into graphic design, go into advertising. And I was like, no, I don't want to do that. But you kind of went along with this, but then you saw this sort of stuff. So AIDS activism, or sex activism, whatever you want to call it, that was kind of around me. It was in the water. It's where I wanted to go. So then when, I think about 10 years, we had this weird scenario last night where we put the mural on Instagram, put a close-up of the mural. We showed the Keith Haring pieces, because he had done things like Dance Right. They had done fundraisers for ACT UP. We showed a hip-hop thing because there was Tribe Called Quest and stuff. There was Red Hot and Blue, I think it was, and Tribe Called Quest, and hip-hop acts, which at that stage, NWA were doing their whole Hard Lads thing, but there was De La Soul and Tribe Called Quest doing this message. And then I showed portraits of the Dice Man, because he's one of my heroes. And I showed an old mural from 10 years ago. And I got suspended from Instagram this morning. Yeah. So that happened today. You know, I've done, man, you know. So that happened this morning. So that's where activism is right now with street art. Unless it's mental health or something that, you know, it's kind of ambiguous. But I went to the workshop where the positive people give positive lives came out. Another person came out with another thing about a cage, which was really good too. But it was also a really hard discussion. I mean, it was just people being very frank and honest about their experiences. And we wanted to include the lines and then going to paint it. I would say it was like an honor to paint it. Cork people are amazingly vocal in a very positive way. They're all like beeping, it's great to see color. The way we painted this, we actually painted it backwards just because of edging. So we had end GMA at one stage, and someone stopped and went, "What's GMA?" It's like, but to the whole thing, what I felt more relevant, even from what you're saying here, is like, a huge mural like this, it's quite big. You know that something's happening. I don't know, I'm hoping it opens a door, because that's all it can do. I can't do anything else. It can open a door that people go, oh, I'm not on my own. There's actually, if they can get a mural together, there must be other stuff. It couldn't just be a mural. That would be ridiculous. Do you know what I mean? So, I know, unfortunately it could, but it's not. So, you know, this is going to be here for quite a while. And that's even more, that's as important, because it's not the one day flashbang wallop. I grew up with like the ribbon. Like, I couldn't buy a ribbon in Dublin yesterday. It's like, I'm in a fucking city. I know. I'm in Temple Bar. I was all around the place going, where'd you get a? Nah, don't do that anymore. What? So, you know, painting this was like an honor, and also felt like people were involved. Whereas sometimes you do this kind of stuff, and I would fear that, you know, it's not trendy anymore. So it'll just get ignored. But I think that would be a shocking shame, because I've learned a huge amount from them, from doing the workshops, meeting people. And I think more people should get that chance, you know?
And so, you know, as we know, like people of all sort of genders and sexualities and life experiences can acquire HIV, it can happen for anyone. But how do you represent those different groups in a mural like this when people do associate HIV with sort of certain kinds of people, if that makes sense?
Well, I always thought, even coming into Cork on the way down to do the mural, we were listening to Stevie G and his block party. And I know Stevie has, you know, got involved as well.
Yeah.
And I've always felt like, you know, Cork is a club in town. Like it was when I was growing up. It was like famed for Fish Go Deep, and you were like the fact of the matter is, maybe not so much now. Things have changed, but like 20 years ago, that's where you met gay people. You went out clubbing, you met gay people. Well, that's not to make them a separate group, but it was just the way it was. It was like, oh, yeah, who gives a shit? We're all dancing. And so to do a dancer was an important part of it. Also, the figure was taken from, it's a sculpture in San Francisco, actually, but it was also before that, it was a temporary sculpture that would go to the Burning Man Festival, and they would burn it down. Next year, they would build it again. And I quite like that idea of that resilience that activists have to have, that there'll be loads of people that say, I keep thinking of, I don't know if you saw the Borat film. I think there's a moment in it where he goes, oh, you got the good AIDS. And then he goes, no, I'm gay. He goes, oh, Jesus, that's the bad AIDS. And you're like, what the fuck are you talking about? But like, it still comes out. Someone says a joke like that and it just becomes a joke. It doesn't have any substance anymore. And it's like, it becomes a fucking evil thing. So, you know, it's that kind of idea of just like, making something that is like, even though any activist has to just stand up again, because you're going to get, every time you win, someone else is going to kick you in the shins twice. and just to keep going. So that's really where it came from, you know? So there you go.
Yeah, and I think, something that you touch on, and the great thing about the mural is that it does a lot of talking on its own. For people who are activists, it must be so exhausting, to, be talking about this, especially if it's your own lived experience. But the mural is there. It's like a permanent public sort of reminder about this conversation. And, hopefully it'll keep people talking, for as long as it's up there on Grattan Street. So I think it's really, fantastic to have it there.
Well, I think what was good as well on the peer-to-peer thing was when we were doing all the design work, he started emailing me and I was emailing stuff back and forth. And we did a lot of designs and we were talking about an issue with these business cards. And he said, oh no, I have an idea for that for you, man. And it was a peer-to-peer moment where we're going hey, I have a guy here who makes this. He'll do it for nothing. Have these. And it's as close to peer-to-peer for that kind of, and I still think that people will help, and I think more people need to know that they can help. And if it's I ring people and say, will you do a design, will you do a thing? Yeah, they fucking will, because it's so easy now. We can send imagery, messages. Everybody who's here, it'd be great if you could just take out your phones and tweet take a photo of any of these things and put it out there. Just use the tiny amount of technology to do this 1 second thing, and everybody should be involved constantly, And that's the message I get from a lot of this,
Absolutely, and I think that's a good point to kind of wrap things up for now. The idea that anyone watching online can take these messages and make them public, and we really encourage you to. It's so important to get this message out there that, obviously stigma comes from misinformation, but the only way to stamp out that stigma is to present the facts, about you equals you, to sort of discuss people's actual life experiences, and reinforce the idea that, positive people live positive lives. Someone who's HIV positive can live a long, healthy life, undetectable is untransmittable, and it's something that I think we should really take forward, not just today, but, for, the rest of the year as well. So I think we do actually have time for audience questions. We will have a roving microphone going around. And if anyone's watching online, I think you might be able to pop questions online as well. So we'll look forward to those. Oh yeah, we've got a question.
Just aside from the Instagram ban, was there any other reaction to the mural from people?
I mean, it was this year we painted a lot of murals, and to give you an example how much more, it's beeping horns, loving colours, can't wait to see it. But we did the 2 Johnnies this year, and nothing is compared to how much they stop in Cork. They literally constantly stop. What are you doing? Really? That's a good idea. There wasn't a step of negativity here. Nobody. They just want to see a new thing. They're interested to see it. They'll be back later. One woman asked me to paint her kid's bedroom. She was too hungover for me to do it now. And so it didn't work out, which is a shame, obviously. But I would be more of it. I think that encouraging people to sort of go, why don't you have a go? They can email me and I will tell them some of the tricks and tools to go and make their own ones. The guys have the stencils of their logos and everything. So we don't want anything, we didn't waste anything, we want to reuse stuff. So we're keep going,
Great.
One thing about having a mural, I think it's great to have it up, and I think it does draw the attention to us. And it's something that Will was mentioning about the 7,000 people with HIV living with HIV in Ireland. And we found when it was the marriage referendum that a lot of what made it possible for there to be the change in society was having a face on it, and that was having people go around and go door to door and say, I'm, campaigning for this. And I think that's something that we need to do with HIV. is not necessarily people that have HIV, but everyone going out and just saying it's something that needs to be talked about.
Absolutely. Yeah, 100%. And I think, do we have another question?
I was really interested, Will, when you were mentioning the theme of this year and being end inequalities, and again, like that idea of there are groups who it's even harder to discuss these things. So I was wondering, could you say any more, say, about sex workers or trans groups or other people like that, and maybe how welcome they are, say, in all of your services or groups, things like that?
Just looking, I do a lot of research on what's going on around the world, like not just Ireland, because again, we're very lucky here when it comes to medication, we really are, but it's the whole other part of it, the stigma and looking down. Like for instance, I'm talking to an American couple at the moment who are both positive, thinking of coming to Ireland, and they were utterly shocked and still can't believe me that their medication is free. They're like, because they're paying a fortune, their insurance and everything, like, and I'm, shit, if they're a fairly okay couple money-wise, like, but it will save them a fortune coming here. But as regards sex workers, trans people, everything, if you have a situation where, in a lot of countries where it's, it's criminalised, how do you get these people to come forward? How do you treat them? Prisoners in prison are another very hard to reach group, like, what can be done? What can be done is we really have to legislate to change laws, because it's really the one thing that creates like disparity of reaching people, of getting to these people, is the fact that you have a law that prevents you're there, you want to help, you want to reach out to these people, but what they're doing is illegal. Like, so I think like we need to actually grow up a little bit in our attitude towards sex, not just sex workers, like, but the trans community, it's very big now at the moment, like it's the issue after gay. But what we forget here in the West, I have a friend in Russia who was living here actually, but had to go back and hopefully may get back here someday. And he's what he tells me about the barriers to medication. You're diagnosed in Russia. You go and you get your medication. You come back 3 months later, they give you a different medication. Because they don't care. There is no gays in Russia anyway, like, so it doesn't matter. I have a friend who's Indian. If you're diagnosed in India and it's free, but if you're taking the free medication you're getting from the public, you have to go once a month. Like we go every 6 months. And if you don't turn up for your appointment in that once a month, the police arrive at your door and bring you to the clinic and declare outside your door when they're banging at the door that you're in there, you're infectious, you need to get here. Like, I think we forget here in the West, even though I still think stigma is our main problem, we do not realise why HIV has never actually been stamped out. It's because of attitudes towards people, how we treat them, how we see them. And as long as you can other the other person, if you can make something the other person, it's fine, because then you can stand there and you can moralise about how good you are and how bad they are. And when you're pointing the finger at somebody, always remember there's 3 pointing back at yourself. Like, I always think, like, so I just think people need to, it's ACT UP, when we come back to ACT UP. That's what mainly ACT UP does today. The old days, like, as John was saying, the dead, the sit-ins, fake blood throwing, protesting in the cathedral in, was it New York, I think? Now we lobby. And before ACT UP Cork started, when I was involved with ACT UP Dublin, we had a number of meetings with, I think it was Harris was the Minister for Health at the time. We had quite a few meetings with him, and that's what we need to do. It's because people might think like, oh, you're an activist, you're out there, you're trying to change things, but it's changing the laws. Because if we can change the laws, then we can work on perception, and people's laws are, changing people's attitude and perceptions of us is one thing. But if you have a law that it's a barricade to what you're trying to do. So that's basically, I think, what we need to do today. I liked what Jonathan was saying about resilience. There have been moments in my life where I just think, I just want to stop. I just want to, because I was accused last year, actually. I was accused of being, if I can use the word, a media whore. I was seeking all this publicity for myself. Why would anybody seek publicity, I said, like, about an illness? If I wanted publicity, I'd love to be doing something like I'm an artist, I'm a dancer, I'm whatever. Like, this is not what I do for me. And back to that's why when we come back to sex workers and everything, if I could reach out to people in our group and let them know, not just our group, like this group is not just for gay men, queer men, lesbian, anybody. It's for everybody. We have straight women. We used to have a straight man. He's gone. It's very hard to get anybody outside the queer community to speak up. Was it 2 years ago, when the whole You Equal You campaign was being started and then COVID hit, I got a phone call from the HSE. Would I like to take part? They were putting up posters in the bus stops. You might have seen them around briefly. That started, and I was asked, do you know any migrants or things? And I was like, are you for real? I said, honestly, do you really think I'm going to get a migrant, a straight woman, anybody to speak up about their status? So they went with generic photographs. They could get 5 queer men, and we're probably going to be used when it goes again, because we're willing. But what does it say about society? What you were just saying about sex workers, when you have women, straight men. I have a friend, actually, because a real example of what's thought about both stigma in a bad way. He was diagnosed with HIV. The man has 3 kids by 3 different women. And his immediate response from his family was, we never knew you were queer. The perception, you see, that you need to change, and you cannot do anything about that perception. You can work on that. Yeah, I think we're working on it. But if you have laws, the barriers about the type of people you're talking about, we need literally to change laws. I mean, if you're sitting in a support group of people, like when I'm there, like in a group, I don't give a shit whether they're gay, straight, whatever, like, they have the same condition as I have. And we're there to try and make our lives better. Because even in the HIV community, there is, God, I hate saying it, but there is a kind of hierarchy. The queer white man up there, then comes maybe the woman, then down here comes the sex worker, then the prisoners, then the drug addict. Even amongst ourselves, like, you know, there's this kind of attitude, and that's what I want to break down. Like, I've known people who will not want to sit in a clinic if there's a prisoner being brought in for his visit. Like, they don't want to be seen sitting in the waiting room, but that's that type of person. That's what you're combating. But it's getting better here. But as the theme says, end inequality, end AIDS. We're not going to do it until we combat what we need to for these people.
We have another question.
Yeah, so this one's actually from online, and the question is for individuals who aren't involved in healthcare or aren't healthcare workers, how can they effectively promote the U equals U message?
I think one of the most important things is just telling people. I mean, if you just, it's amazing what you can do just by simply, well, when the pubs are open again, or whenever you just simply say, you know what I heard? And if you just say that to half a dozen people, and they say it to half a dozen people, you have changed somebody's lives dramatically. And so it is, if it's something as simple as that, just simply going, hey, you know what I heard today? To just people that you know, and spreading the word. And, you know, I think it's also that same coin is just speaking up when you hear things otherwise. When you're sitting in the pub or somewhere and you hear someone saying, oh yeah, well, you know, those fags will give you AIDS just by sitting next to you. And you can say, well, no, actually, I saw this thing about U equals U. And so if you speak up, I think that's the number one thing that we can do as non-healthcare professionals, just the regular Joe, the regular, you know, punter, is just that open your mouth, talk about it.
I'd agree with that, but I also think, as John was saying, like, if people today watching this want to just start tweeting, do whatever. Like, I mean, I would love to say that I'll tweet or I'll anything, but I'm 64, I'm a kind of technophobe. My main tweeting, well, not tweeting because I don't do it on Twitter or anything, is Facebook. And I literally, this month, have just been posting non-stop. I think people must be fed up of my posting on the U equal US message, the message about inequalities and things, all through this month. And I think if people saw a post, just repost them. That's all that somebody has to do, like, because that starts a conversation then, like amongst a group of friends. I have literally posted, because it sounds terrible, but I'm involved in so many groups. I have posted in every one of them, and none of them have rejected the post. Like, you know, sometimes the post has to be passed or whatever. Every single group has put it up. And I think, like, if young people watch it, because everybody, young people are on social media today. If young people just come across that message, they might talk to each other about it. Repost, I think that's what they say. Just do it.
Yeah, absolutely. I think that's a good call to action. We might invite everyone down to the mural as well to have a look. But Martin, you might wrap us up.
I just want to say thanks to everybody. That was a really engaging conversation, and thanks to you all for being involved. It was lovely to hear about Cork AIDS Alliance at the very beginning and where it was. So Siobhán, thanks so much for that, and to all the founding members, to John and all in ACT UP Cork for all the activism that has been going on for years, to Will and the group in Positive Cork, and that ability to provide peer mentoring and peer support here in this city, and to Jonathan for bringing Positive People Live Positive Lives to life. Thanks to Eleanor, who started off this project inside with us and brought all these people together and facilitated this, to Siobhán Clancy and everyone in Cork City Council, actually, who supported us on the way through, and of course, to Eleanor Moore and Trina Healy and the Cork South Community Work Department, who kind of made it a reality for us and brought us to this point. So yeah, it's a really good finish and a call to action. Everyone can go down, you know where it is. It's behind the courthouse on Grattan Street, very close to us on Peter Street, and it looks absolutely fantastic. So do take a picture, tweet it, Facebook, Insta, wherever you can, and have a conversation today. And not just today, it's with us for 6 months, so keep the conversation going from now on. So thank you very much.